When someone is raped or sexually assaulted, preserving evidence is key when it comes to holding the person responsible accountable. In Indiana, women often have to drive more than an hour to get a forensic exam. We just reported on a case last week involving an IU student who had to drive from Bloomington to Methodist because where she went to the hospital at that time, there was no one available to do a rape kit. Why is this happening and what can be done to change it? Well, Angie Morris is a nurse and Indiana's SANE Training Project Coordinator, and SANE stands for Sexual Assault Nurse Examiner. She joins us live to tell us more about it. And I think last week, when we first reported this on this IU story, she had to drive from IU to Methodist. People are like, well, why would that happen, especially on a college campus? What do you know about this? I think there are SANE nurses there on the college campus, but what would have perhaps happened here?
So I'm not really sure what happened with this case, but what I do know is that this is certainly not a one-time situation. Oftentimes victims will present to an emergency department for a sexual assault examination, and for whatever reason, the hospital staffing or maybe the hospital just doesn't have anyone trained, there's just no one available. So many of these hospitals don't have access to a sexual assault nurse 24/7.
And when people hear that, they say, wait, what?
Right.
Especially on a college campus where you have men and women that could be going through something like this. Right now, when we're talking about this, really, you're thinking about the trauma of the victim, what they're going through in that moment. What are you telling them? Are they supposed to, at that time, go do some research and find out where they should be going?
Absolutely not. That is not what we want for them. So we try to work in each community with a sexual assault response team. And what that means is that there's a multidisciplinary approach, including law enforcement officers, hospital and healthcare providers, as well as victim advocates. So, what victims need to really understand is getting to the emergency department is important if they plan to pursue criminal justice, the criminal justice avenue, they can do that as well. But reaching out to a victim advocate will really help kind of get them to the right place. We try to keep our victim advocates up to date on where we have coverage, and at least that can be someone else that can support them in picking up the phone and making these phone calls so that it doesn't become an assignment for them.
Yeah, can you tell us a little bit about, in Indiana, do you have to have, if someone's going to do a sexual assault kit, do you have to have some kind of certification or training? And then if so or if not, why aren't we making that a priority to have more?
Yes, so in the state of Indiana, you do not have to be formally trained to collect evidence for a sexual assault kit. That is absolutely never the recommendation. We want patients to have an understanding that if you're having a kit done, has the person that is doing this kit for you been trained? Because the outcomes do matter. And it's not just about the evidence kit, it's about so much more. The trauma-informed care that they receive, the actual formal examination, just making sure that everything is okay with them and that they know what comes next, and that whoever is collecting that evidence has an understanding of both the medical and the legal implications that can be associated with this case.
Yeah, I understand too that training can be expensive, but I would think that either hospitals or possibly our government would want to make that a priority. What do you have to say about that?
Well, it is challenging. Healthcare has seen a crisis, obviously, like we haven't since COVID-19. But the Indiana SANE Training Project does offer free training for healthcare facilities to at least get the nurses kind of up and going. It's just going to be the hospital's responsibility to make sure that they're retained and that they have support to do this job and that there's someone available 24/7, and that's really hard.
That's the big thing, is that they might say that they have someone on staff, but then they're not there, or they have one for 365 days, 24/7. We're out of time, but I am going to put up the information. If you would like to see the list of hospitals that say they have a SANE nurse on staff, either full-time or on call, we're going to have that link for you. And for someone that you may know that goes through this, fox59.com/Angela Answers. Thank you so much, Angie, for giving us more information on this. I did not realize that we were still in this predicament here in Indiana.
Thank you.
Yeah.